Hi, my name's David Fulcher, and I just wanted to give you a quick rundown on the online Immunology for BPTs course. First of all, who is this course designed for? Well, it's basically aimed at anyone training in internal medicine. In Australia, we call these basic physician trainees, people who need to know the basic sciences of the immune response, but particularly focusing on those aspects of the basic science that doctors are interested in, specifically the clinical applications. It's also of benefit to paediatric trainees. The same similar course material overlaps between adult and paediatric, and we do have a specific paediatric immunodeficiency lecture thrown in. Other people training in other specialties outside internal medicine often need to know some immunology, and this covers all the basic sciences that will be relevant there. And even established physicians and internists who need to update themselves on immunology and immunobiology, given the rapid pace of change over the last 2 decades, will likely find a lot of useful material in this course. So how does the course work? There's about 30 separate lectures combining the concepts of clinical immunology with immunobiology. So clinical immunology, namely the diagnosis and management of patients with immunological disease, and the basic sciences of the immune system encapsulated by the concept of immunobiology. Put them two together and we get clinical immunobiology, the basic biology of the immune system that's specifically relevant to the immunopathogenesis of disease and therapeutics, and therefore of relevance to those in medical training. So, for example, we cover the classical complement pathway, everyone's favourite topic, but we include immediately lectures on complement disorders such as hereditary angioedema. We talk about, of course, immunoglobulins and their subclasses, but we don't leave it there. I then go straight on to talk about IgG4-related disease, for example, as well as antibody deficiency states such as common variable immunodeficiency. Now, immunology is a very graphical science, and so encapsulating the workings of the immune system in diagrams, I think, is fundamental to its understanding. So we have a lot of graphics throughout the course, most of which I've drawn myself specifically to illustrate those specific aspects that I'm talking about at any one time. So over 400 graphics are thrown in into the course, including some videos. At the end of each lecture, we have 3 MCQs just to reinforce the knowledge that we have covered, and I work through the answers with you. And at the end of the course, we do a summary of the entirety of the immunobiology, which I call Immunology in a Page, where we work through this roadmap of the immune response to make sure you've grasped the key concepts. At the end of the course, after the Immunology in a Page, there's a 50-question MCQ section where I work through all the answers sequentially, and that allows you to bring everything together to make sure you've grasped the core content, as well as pointing you towards bits that you need to go back and revise. I'm very grateful to those helpers who give the extra lectures for the course, namely Professor Mingwei Lin talking about vasculitis, Dr. Dunkley talking about transplantation, and Professor Therese Cole, who gives the pediatric immunodeficiency lecture. Now, how does the course work? It is a series of streamed video lectures that you can sign on for at any time. You rent the course for about 30 days. During that 30 days, you can pause, replay, revise as much as you need, as long as you get through all the material in that time period. You can send me any questions via email. All the course format is available in written form as the primer of clinical immunobiology. So I've written this book specifically for the course. It's one chapter. per lecture, or one lecture per chapter, whichever way you like to think about it. It is available as a print book as well as ebooks for both Apple Books and Kindle, so you can work through the lectures or work along with the lectures with one of these supporting materials. The MCQ also has its own ebook, which is again available from the same sources, and there are separate lectures of the MCQ section if you wanted to do that by itself without the rest of the course. Not necessarily advised, but it's there. So this is just to show you the relevance of the course. These are some of the topics that were in the physician's exam in Australia in 2025, along with the relevant slides which would have answered anything that would have been asked in this line. So if you work through those topics and ask yourself how much you get and how much more you need to know before the exam, this will help you hopefully get there. So just be aware that there are two overlapping courses. Traditionally, I've run the Immunology for BPTs lectures for over 2 decades. I think most people are familiar or have heard of those lectures. They are basically the core lectures that I've talked about, along with the 3 supplementary lectures given by my guest lecturers and the MCQ exam bundled into the package. But if you just wanted to do the core lectures as outlined in the primer of clinical immunobiology, so you want lectures to go with the chapters of the book, those are also bundled separately as the Immunology for Physicians course. Specifically, let me stress, not the extra lectures and not the MCQ exam. I also have a number of other learning activities that you should plug into. One is the Patreon teaching and revision exercises. The address is there. Basically, this is an online community of people wanting to learn immunology, and I post revision exercises and learning exercises, mini lectures, sets of MCQs, as well as any news that happens to come up which helps reinforce your knowledge of immunobiology. I've been running that now for over 2 years, so there's a stack of material already accumulated, and I like to top it up every week or so with anything that happens to come to light. Now, getting access to the Patreon materials does cost a small monthly fee, depending on how much you wish to access. Some of the material's free, some of it requires a higher level of subscription. Just bear in mind that all the money that goes into these subscriptions gets passed on to the World Wildlife Foundation. So supporting both causes is a real positive bonus of this aspect of teaching. So this just summarises all the learning resources available to you. I've spoken about Vimeo, I've spoken about Patreon. You should now be aware of the primer of clinical immunobiology as well as the MCQs in clinical immunobiology for those who are exam focused. I should also finish by mentioning the Instagram site Question of the Day, where I put quick take, 1 to 2 minutes, fired questions about immunobiology with quick answers. So you're welcome to follow me on the Instagram site. All of the information that I've mentioned is on immunologyforbpts.com. All the links are there. So just head across to that site if you want to chase up anything that I've mentioned so far. And that is our course in a nutshell. So I hope this will be of great use to you in your preparation for medicine, specifically any exams you might be doing. Feel free to email me if there's anything else you need.